by the state or anything like that. So we get to see kids 6 months, a year and a half later, graduating and getting on with their lives, and we get to help kind of implement that transition back into normalcy. And one of the things I'm going to talk about is some building blocks. And one of the things in treatment that we figured out is there are certain building blocks that sometimes we're good at dealing with, and sometimes we're just poor at dealing with. One of the building blocks is education. And a building block, the reason that's an important building block is, well, let's talk about adult treatment for a second. Adult treatment, we would always want to look at someone's career, right? If we don't look at someone's career, we can miss a big piece of different temptations, how somebody feels about themselves. If we look at the way we treat doctors, lawyers, nurses, anybody who's licensed, boy, we fall all over ourselves to try to set up programs so that they can stay within their career. And then with kids, there's still a lot of programs to say, don't worry about their education, we'll just do treatment, we can figure that out later. So the kid gets out with a lot of pressure a lot of times. Plus, it's really hard. In fact, many diagnoses cannot be made. You've left out a whole axis of diagnostics if you leave out the education piece, and you don't get to see the child concentrating or not concentrating. Try bringing these cupcakes into our kids' schoolroom and watch what happens. They'll be like frosting on the ceiling. I'm surprised there isn't here since Jeff is here. But they'll be frosting on the ceiling, things going around. Kids just when we brought the cupcakes in, did you notice how noisy it got in here? You ever been in a restaurant when you got a group of like 40 people come in and then all of a sudden they get wine and the level of it just all of a sudden everybody's talking louder. That's how you guys were with those red velvet cakes. I mean, it was just like. It took David like 6 minutes. It was a presentation. You guys calm down. But that with kids, seeing that and seeing how they respond is really important, and being able to pass that on to the treatment team is very important, so that the psychiatrists and the therapists and families can know how to deal with their kids and what kind of educational situation is going to be best for them. So what I'm going to be talking about is some building blocks here. And when we talk about kids, adolescents, let's remember where this starts. What's the average age of first use for an adolescent? What's the average age of first use for an adult? 8 to 10. 8 to 10? No. Alcohol, illicit drugs, and pills. And the reason is, now, here's the thing. So some of you are thinking, Johnny's smoking crack at 9? Who taught him to smoke crack at 9? Now, most Johnnies are not smoking crack at 9 years old. Most of the time, if Johnny at 9 years old takes $10 down to the corner to go see Chewy and comes out and says, I'd like to buy some crack, Chewy's going to slap him upside his head, take the money from him, and say, and I'm calling your dad. No, that's not what happens. A cousin's over, an older brother or sister is over, something like that. They're hanging out together. This is one of the examples that I use is that, so Johnny's out, he's playing his Nintendo thing. Mom and Dad say, we're leaving for the night, your sister is in charge. Sister is 14 years old, and he's like, okay, whatever, as long as she leaves me alone. And so he's playing for about an hour. Sister has 3 friends over, and all of a sudden he goes, it's very quiet. I must disturb my sister. Right? How many of you have little brothers or sisters? Do they knock on your doors now? They still come right through the door, right? And when I ask this in a high school, I say, how many of you have younger brothers and sisters? They raise their hands. I say, how many of you think your brothers and sisters know how to use, how to knock? None of them. They just come right through the door. They go every time, right through the door. So Johnny goes, oh, it's too quiet. Comes through, comes by his sister's room, opens the door, boom. Sister has a bottle of beer in her mouth. Friend has a joint in his mouth, in her mouth, and Johnny goes, what does Susie do? I'm telling him. What does Susie do?
Put a joint in their mouth.
We've been waiting for you. We did this all for you. You get to, where does a younger brother or sister want to hang out? With the older brother or sister. How many of you, if you had a younger brother or sister, how many of you had to beat them just to, like almost unconscious, to get them to leave you alone for half a second? So you can duct tape them to a pole too. That's if you don't feel like beating younger. Maybe you still have to do that. I have a younger sister, and sometimes I'm like, go. So here comes Johnny. Johnny comes in the room, and Susie smokes a little pot, drinks a little alcohol, whatever, hanging out with the older kid. He's like, this is heaven. Does he have a good experience or a bad experience? It's a great experience. He's walking with Billy on the way to school the next day. One of those 14-year-old girls going the other direction says, "Hi, Johnny, how are you? Fun last night," and keeps walking. Billy's like, "What the hell? What happened to you?" New friends. Okay? It's a good experience in so many different ways. And the next thing he says is, "By the way, Billy, the dare officers are full of it." I had a conversation with my daughter that is now about to have that baby. Did I mention that I'm going to be a grandfather in December? So Justine was sitting at the table, and she was talking to me. She says, "You know, Dad, I have a friend, and she smokes pot, and she's still my friend. She didn't grow horns out of her head. She didn't look like that commercial showed with meth. She didn't do weird things. She can still talk." Us back. What my daughter's comment was, "She gets better grades than I do." I said, "Yeah, I know. I understand." I said, "What does that say about all the dare officers you listen to?" She said, "They're liars." She's 12 years old. She figured it out. Bunch of liars. They didn't tell her the truth. They didn't tell her it was going to feel good, that it was going to look good, that it would be good, in fact, for a lot of people. Now, it has a bad effect, but when you're honest with kids, you say, "Look, it's going to feel good." So then you're honest. But everything that the drugs and alcohol give you, it's going to take away. So when you think about it, they're starting very young, and these things are imprinted very, very, very early. I mean, you can take the whole addiction issue, and we talk about the midbrain and how there's the different levels, and there's fight or flight, and there's, food and the other F word, and then there's, all these different things in there. You're like, "Ooh, I want to go to the midbrain training." What's the other F word? So, anyway, so there's all of those things that we hear about, but how about just taking a 12-year-old brain and adding a very, very powerful mood-altering chemical like the way marijuana is now, or Adderall, or Vicodin, or Xanax, Soma, how about Chlorocetin, how about kids are smoking? Do you guys know what salvia is? How many people know what salvia is? Raise your hand. I can almost guarantee you that 90%, maybe 95% of the kids that you work with, if they've done drugs, are doing salvia. Salvia is kind of an herb thing that you can get on the internet. It's not even illegal in the state of California. It gives you hallucinogenic type effects for about 15 to 30 minutes. It's very powerful, very potent, and there's some evidence now that there was a young kid who committed suicide while under the influence of salvia. Oh, brings us to another point. Last week I got to do a presentation with someone who's one of the experts on adolescent suicide in the state of California. Every month, she goes down to the LA coroner's office, and they go over every suicide that was under the age of 25. And what happened? I said, I just asked one question from her. I said, when I got to speak, I said, "I just have a question for you. Are most of the suicides under the influence of a mind-altering chemical?" She said, "Yes." Why is that significant? Well, first of all, as we help people get off chemicals, they're going to do better. The other thing is, though, does getting somebody off chemicals treat depression? Does it fix depression? Not necessarily. But do chemicals shorten our trigger when it comes to impulsivity? Couldn't 2.5 seconds make the difference between pulling the trigger or not pulling the trigger? Driving over the edge or not driving over the edge? Opening the door of the car to get out because somebody's gassing themselves or something like that. And she said, absolutely, most of them have they're on some mood-altering chemicals on board when they commit suicide. So getting kids away from chemicals is just really important. Stand